Keith RN, and I am a man on a mission. And my mission is to empower educators with innovative tools to develop clinical judgment so students are better prepared for both practice and licensure, including the upcoming next generation NCLEX. And, that's something that a lot of us are thinking about. And that's kind of where we're spurring and having this conversation on clinical judgment. And so I'd love to know, what questions do you have as educators about clinical judgment? What do you need to know that you need to have clarity to confidently teach? And I'll kind of highlight what we've talked about so far, but I would just love to get your questions in the chat early so I can address them later on in the chat or as soon as I see it. So if there's a chance and an opportunity, if you have anything that's pressing that you have on clinical judgment, I'd love you to do that. And if you've been living in a cave, you know that clinical judgment is the current buzzword in nursing education, and it's there for a reason. Because unfortunately, approximately only a quarter of our graduate nurses have entry-level expectations of clinical judgment. It's a weakness that we must strengthen in nursing education. That's why we're having Next Gen NCLEX in the next 2 years. And it's a good thing. It's a little fearful, a little anxiety provoking, but at the end of the day, it's going to be something that's going to strengthen and be part of the needed change that's needed in nursing education. And some of you have been around long enough to remember when critical thinking was the buzzword 10, 15 years ago. Gotta get students critically think. Well, then after Benner's book came out in 2010, Educating Nurses, they call for radical transformation. Clinical reasoning. Dr. Benner and the Carnegie Foundation said we need to emphasize clinical reasoning to basically improve nurse thinking. So clinical reasoning, the process of thinking at the bedside, became the emphasis. Now it's clinical judgment. And for some of you, your heads might be spinning saying, what's the difference? Critical thinking, clinical reasoning, clinical judgment, they're all the same. Well, let me just briefly highlight and say that's not the case. Critical thinking they're all needed though, to think like a nurse. And so if we're going to strengthen our programs, we need to start with emphasizing in, critical thinking, numerous definitions, the essence of critical thinking. What are your students able to understand about the content and then apply it to the bedside of patient care? There's numerous others. That's my favorite from Potter and Perry. Clinical reasoning is the application of knowledge. And even the NCSBN model of clinical judgment recognizes that you, in those multi-layers, you've got to have knowledge. And we all know that, but knowledge needs to be known, understood, and then be able to be applied. And that's the essence of critical thinking. Clinical reasoning is that reasoning at the bedside. And that's really where we need to focus on, because the outcome of a correct clinical judgment hinges on whether our students understand the content, not just memorize it to pass the test, reason at the bedside to make those correct judgments. And clinical reasoning, and I'll talk about some of the processes in other Facebooks that we've had that discussion. And so that's what we're going to be talking about. And, we've been talking about the CBC. CBC, for many of you, is concept-based curriculum. But I want to kind of give you a different framework of how I would love to see nursing education be transformed by moving to a different CBC. And that is a case-based curriculum. And actually, medical education, the strength of medical education is a case-based curriculum. They've been using it successfully for decades. They're immersed in practice, medical school, residency, and then on to practice. And nursing education, we can learn from medicine. And we can learn that the power of a case-based curriculum will be the focus of tonight's Facebook Live, and really talking about why case studies. Why are case studies one of the most powerful and practical ways to develop clinical judgment? But, I see some things in the chat. I kind of got my cheaters on. Unfortunately, I'm getting old And I just want to kind of see who's out there tonight and what some of the questions are that are coming in. And so just want to see what's out there. And Ashley from Lincoln, Nebraska, thank you for joining us. And Laura Sperry says, what suggestions do you have for helping students to come prepared to work through a case study in fundamentals? And you know what, Laura, that's a great question. You know what? Let's go there real quickly. One of the things that I've noticed we need to just strengthen in nursing education is expecting our students to come to class prepared. But do we as educators set that boundary? And so, Laura, in answer to your question, do you expect your students to come to class prepared? And one of the things that we can do, Laura, if you're using case studies, whether they're Keith RN's or anyone else's, there's usually multiple questions. And so my question would be to you is, take the best place to start with getting students to come prepared. Number one, expect it. But number two, be able to then assign a portion of that case study, the first 2 or 3 or 5 questions or the first section. So like in a Keith RN case study of skinny reasoning, I've got it, part 1 is 2 pages. That can be a pre-class activity. Any case study, you can do the same thing. Assign it, give your students that information ahead of time, and then they come to class, then you briefly review it, go over what they know. They bring it as their ticket to class, that they've done the work. They're coming to class prepared, not just clinical, to get admission. And then review it together as a class, that pre-class case study, the portion of it, just a small portion, get them thinking, get them reading the textbook, and then go on from there, and then break the students up in small groups. Do whatever you do for a case-based scenario. But Laura, that would be my best response. And I hope you found that helpful. If there's some questions or clarifications, please put it in the chat. And Janet's asking right off the top, how do you think simulation can be improved or changed to better develop clinical judgment? Janet, that's a great question. And kind of just some thoughts that I would share on that is, number one, simulation is a powerful strategy. So that in and of itself is one of the best practices that we can use as educators. But what we need to be sure that we're doing is that we need to be integrating the clinical reasoning processes of Tanner's clinical judgment model. That's an educational and best practice framework that borrows heavily the NCSBN model for Next Gen, by the way. But the 4 processes of Tanner are noticing. First process. Do you ask questions, for example, Janet, that when your students are doing the simulation, do you have reflection questions or an expectation? What are you noticing in this simulation? What are you noticing in this scenario? What are you noticing of the vital signs? And being able to help your students reflect, have a pre-reflection, kind of like a simulation questions that they should be asking themselves. Carry that in clinical. So what are you noticing? And then why is it significant? You know, the step 2 of Tanner's framework is interpreting the data. So once it's been noticed, what's the interpretation? You know, and NCSBN does the same thing. Recognizing cues is step 1 of NCSBN. Step 2, analyzing the cues. Same thing. So in essence, are we asking questions so our students in simulation can reflect on that? And then we go to the responding as we generate hypotheses, possible meanings of the data. What's the possible problem? Plan of care that flows from that. And then evaluation. But one of the things that I did with my case studies and that I did with my students in practice is developing a framework of clinical reasoning questions that are open-ended using Tanner's framework of clinical judgment. We talked about Tanner's framework last time, 2 weeks ago, talking about curriculum frameworks. I have a YouTube on that topic, about 3 minutes long, on my YouTube channel, Think Like a Nurse. Please check that out. If you got a little bit more time, go to my Facebook page, Keith RN, Think Like a Nurse. And under videos, there is 2 weeks ago, our Facebook Live on curriculum frameworks. So please take a look at that, Janet. And I think you'll find some really helpful information. Get the wheels spinning. How can I make these processes of clinical reasoning questions? That's exactly what the NCSBN model of clinical judgment is doing for Next Gen. They took the 6 steps, borrowed heavily from Tanner, and made questions. Use that same process in simulation. Another quick strategy too, Janet, that faculty have used with case-based, with case studies, assign a portion of a case study, whether it be a Keith RN case or any others, assign that as a pre-simulation activity, and then basically go through it briefly, do a pre-briefing on that preparatory case study. Then your simulation is intentionally structured to be the unfolding of the next step of that case-based patient scenario. So again, you can make those yourself using Tanner's questions. That's what I've written as well. But that's a couple strategies, Janet, I hope you found helpful. If you have any question, please put it in the chat because I'll be paying attention. Because really, I want these Facebook Lives I don't want to be the sage on the stage. I mean, God has given me some talents and abilities, but I want to share my knowledge. But more importantly, you share yours and your questions. So Laura, I'm glad you found that helpful. Thank you so much. And Amy put the chat there, the frameworks to teach clinical judgment. Yeah, Janet, thanks. I'm so glad you found it helpful. And if any of you have any other questions that are watching tonight, I'll keep my eye on the chat, keep my cheaters on, and we'll keep going. So anyways, yeah, I did mention that we, from last week and all of that, we've been doing this now. This is part 3 of a 3-part series. We did part 1 was on defining clinical judgment and how important it is to define our terms, because clinical judgment, if it's not defined correctly, will struggle to hit the mark. And that's why we must remember that clinical judgment is an outcome that can't be taught directly. There are clinical reasoning skills and critical thinking skills that we can teach. We'll talk about those in future discussions, but in essence, can't be taught directly. We've got to do the hard work of getting our students to understand the content and then reason and apply with it. That's why application is essential. That's why case studies. That's a little precursor to why case studies are so effective and why Next Gen is using case studies, because they help bring that application. There's nothing else like it for teaching a practice-based profession. It's one of the best strategies to do, and we'll talk about that from the literature. And then last time we talked in part 2 about curriculum frameworks to teach clinical judgment. And I really, advocate Tanner's framework. It's Chris Tanner is a preeminent educator who developed this framework based on over 200 studies that she synthesized in 2005 on clinical judgment in nursing, and really came up with these 4 processes that I've mentioned. But if you're not familiar with Tanner, you need to be, because it's a foundational theoretical framework that's practice-based, research-based, belongs in your curriculum, to be honest, as one of your theoretical frameworks. It should be the framework in every nursing program. There is no reason why Tanner's framework is not more widely used. In Canada, it's used in every program. It's a theoretical framework that they have mandated in Canada. I hope that we get there or do it voluntarily here in the United States. Great. And so, Laura and Laura say basically, they're going to assign some free sim work. Thanks for the suggestion. So be creative. As educators, you are inherently creative. Use your knowledge of what your students need, your student learning outcomes, and put it all together to rock it. And I'm just want to put fuel on the fire and empower you to do that. And so, thank you again for answering these questions. And one of the reasons that I'm so passionate about what I do with Keith RN is that there is something that I have experienced firsthand. Many of you have as well. It's called the academic practice gap. And it really is this disconnect between how nursing is taught and how it's practiced in the real world. And that's a whole nother Facebook Live, but we're teaching way too much physical assessment skills that don't belong in our program. Put away the tuning forks, please. They're never going to use it in practice, but some programs, and even where I taught, we did that. And so we need to step away from that. But you know what? My passion is to bridge the gap between how nursing is taught and practiced. And all of you have a lens of practice. Never lose sight of that. And so recognize that you can all be part of that needed change. And so, there's one strategy. I'm all about bridging the gap. You know what? We've got a disconnect right now. Let's just be honest. Let's own our stuff as educators where we see the change and need the change. You know what? There's a problem, but there's a solution. We can bridge the gap using practice-based pedagogies, not Jeopardy games, by the way, which can help with knowledge, but they're not practice-based. Let's bridge it with a salient, realistic, unfolding case study. And if you know anything about me, you know that if I'm kind of like Chick-fil-A or Raising Cane's, they do one thing and they do it really well. That's called chicken. And for me, I just want to focus on what's the go-to strategy that can really lay the foundation. Don't do it all the time. You got to mix it up. But what can be the foundational strategy to really innovate, transform your program, bridge the academic practice gap, prepare students for practice, and prepare them for next gen, as well as the current NCLEX? It's called unfolding case studies. And I'm going to share with you just some of the findings of my dissertation. And I just basically would like you to know that, I'm immersed in the literature, and, my desire as a PhD student and now a PhD is to really look at the literature to guide us, not to look at me, look at the literature. And my goal is to take the literature and flesh it out to help us as educators make best practice practical. And what is best practice? Well, McLean in 2016 had a comprehensive review of the literature called Case-Based Learning and its application in medical and healthcare fields, a review of worldwide literature. And Amy, you have got to put that link in the chat, because I want you all to download this article. You can, I think, download the actual PDF. It's on the web. You don't have to go to your library site. It's publicly available. But McLean identified that there are 4 key aspects that case studies are very unique. Number 1, case studies develop clinical reasoning and clinical decision making, that they provide repeated experiences to practice. Now, I inherently recognized this 10 years ago when I began my journey of transforming how I taught in my classroom, that we have to practice any skill. Do we not? In nursing education, sterile technique, med administration. No one's born being a good med administrator or sterile technique. Got to practice, practice, practice. Well, our students haven't been getting enough practice of clinical reasoning because of COVID, the pandemic, clinical hours shrinking, a lack of, you can name the scenarios, but what can you all do in your classroom, in your post-conference? You can bring in a case-based scenario and you can practice the reasoning skill with open-ended questions. Case studies also immerse students in the complexities of real-world practice. And that's really where my strength as a nurse who's recent in practice for 36 years at a large metropolitan hospital here in Minneapolis, I took what I saw in critical care, ER, rapid response team, where all those specialty areas that I worked, and I saw scenarios that's like, wow, this is a great case-based scenario. Now, I modified the content that did not violate HIPAA in any way, but I took the essence of what I saw, the themes of multiple scenarios, distilled them into case-based scenarios. Another strength of case studies, according to McLean, is that students acquire deep learning of what's most important. And there's a lot on the science of learning about deep knowledge. Dr. Benner talked about it. Deep knowledge of what's most important. That's why TMI is an enemy of the best in your program. We need to get rid of infobesity, shrink it down to the need to know what's most important to first-year generalists, and then make sure our students understand it. And in the conclusion of the abstract, this is what it said verbatim, that case studies aid in connecting theory to practice. And the impact of case-based learning can reach from simple knowledge gains to changing patient care outcomes. And that's what it's all about. Improving outcomes. Everything that happens in nursing education impacts the community. Nursing education is not Vegas. It doesn't stay in Vegas. It doesn't stay in our programs. Our students will graduate someday, and some you're a little fearful of. Some will pass. Are they safe, practice ready? That's our goal. Like a good drill sergeant with kindness and compassion, we want high but realistic standards to prepare our students by practicing clinical reasoning. That's why case studies. I want you to really understand the why. I'm not here to promote my brand of case studies, though I think they're pretty good. And I got a lot of testimonials from educators that really value them and like them because there are some distinctives. But I just want us to get on the same page of transforming how we teach. And some of the things I learned from my dissertation as I did a review of the literature, I spent hours and hours drilling down in the literature on every topic related to unfolding case studies for my dissertation study. And what I learned is that case studies also in the literature of nursing improve problem-solving skills compared to lecture. Because a good case study is like problem-based learning. There's a problem that needs to be solved, and our students must get immersed in the realities of clinical practice and putting it all together. Case studies also improve reflection ability compared to lecture. It even improved the physical assessment skills development in the skills lab when it was a case-based scenario was used to contextualize the content. Because what Dr. Benner advocated in educating nurses, we need to also contextualize the content to the bedside of patient care. What does that better than a case study? I don't think there is anything, and the literature supports it. Case studies also used frequently improve HESI and NCLEX pass rates compared to lecture. So if you're looking to improve your pass rates for NCLEX, if we're kind of worried about that, adopt a CBC, case-based curriculum in your program. And what's really fascinating is that as I looked at qualitative studies, I'm kind of a numbers guy. I'll admit my bias. I like the numbers because they don't lie. Qualitative themes, though, also support case-based learning. And you can use this information. Some of the themes that the students had in some of the qualitative studies of case studies was this. They were engaged in the learning process. And how many of ours, one of the most common complaints I hear from educators, how do I get my students engaged? Well, really simple. Use active learning that's relevant to practice. Find a good case study. Write your own. Derive them from, use Keith RN or use anyone else's, but make it practical, make it real. Another theme that students identified is that they developed essential knowledge and skills. And actually, the small group work, though some resist it, most students in the qualitative studies that I reviewed for my dissertation, they valued the peer support, the teamwork. And that's an adult learning theory principle. Adult learners, in general, value small group work. But what I love about the final theme was this, is that they help the students to understand their professional role identity. And, I love the work that Dr. Nelda Godfrey is doing on this topic right now with Sigma Theta Tau, and I'm involved in one of the educator groups of professional identity formation with Susan Luperell and Beth Smith, I do believe, and they're phenomenal, and we're doing some great work to help get this integrated into our curriculum. But case studies bring that context and using that reality. So, if there's any academic nerds out there, I've got the S3 file link to my dissertation study. It was relatively short, only about 80 pages. But chapters 1, 2, and 5, and the chapter 1 is the problem. Chapter 2 is is the review of the literature, and 5 is the application to the why and next steps. Those 3 chapters are you could read that in 30 minutes. Would be very powerful to really help you see what's in the literature for yourself if you'd like to go deep. So please do not hesitate to do so. But, I'd love to see nursing education kind of see case studies differently. We've been looking at case studies. We've had them for quite some time. They're not a new phenomenon. Over 100 years. We see them as case studies, and they're all and kind of like they're all the same. But really what I want you to recognize is that a well-written case study is not just a case study. It is low fidelity simulation. That's really important. A case study that replicates the reasoning and the thinking is not just, going to apply learning. Yes, a case study will do that. But a well-written case study will simulate the thinking of clinical reasoning and practice those reasoning and application skills so our students can transfer knowledge from the classroom to the bedside in clinical. So I'd love to see us in nursing education see case studies differently. They really are low fidelity simulation if they emphasize clinical reasoning. But this is the $1 million question that my dissertation study did answer in part. And I want to throw this question out there. I'd love you to answer it your best. How many unfolding case studies does it take over the course of a semester to have an impact, a measurable impact, a statistically significant impact on developing critical thinking? How many? Is it 2 a semester? Is it 3, 4, 6, 8, 10, 12? Put some numbers in the chat. And because this is going to give you an idea of how frequent we need to be implementing case studies in our classroom. Because at the end of the day, they're simulation, similar to high fidelity simulation. You just don't have the skills lab or the mannequin, but you're practicing the thinking. So how many reps? Karen says 20. Melissa says 7 to 10. Anybody else want to put their, kind of throw it out there? I'll wait just a few more seconds. Ashley says 12 in a 16-week semester. Laura says 3 to 5. Veronica, 15. Okay, so we're kind of like covering all the bases here. Well, based on the studies that I did with my dissertation study, this is what I found out. My dissertation, so I'll kind of warm you up here. One study that did two case studies in a semester, no measurable impact on critical thinking. Next, my study did 3 of Keith RN case studies, no measurable impact on critical thinking. Then there were a couple of studies done in Asia where they did 8 studies. They had a statistically significant impact of a P of less than 0.05 on key metrics using the health science reasoning test, which is the same inventory that I used, the instrument that I used for my study. And they got statistically significant results, pre-test, post-test. So if I were to throw this out there, 8 is in essence a minimum. I would venture to say that if you're doing 6 or more case studies or simulation experiences a semester, and I would say, one of the, Melissa asked how long the semester is. If we're looking at the 16-week semester on average, do it half the time, every other week. That is going to definitely have a measurable impact according to the most recent studies. And that's why if you download my dissertation, you'll see where those studies are. And so, and you can look them up yourself and you can get that information. So this is what I'm going to advocate for educators. Be doing it at a minimum every other week in your program, from fundamentals in semester 1 all the way to the end of the game. You know what? If you are doing that, you are going to rock it for next gen. We don't have to fear next gen. If we're practicing clinical reasoning skills using Tanner's framework, case-based learning, they're going to get 3 case studies on next gen. That's it. 3 case studies, 18 questions that capture the essence of Tanner's framework. And we're all getting excited about that? Let's not. Let's just say, you know what? the students starting this fall, if you're doing a 2-year our students that are in the RN level, they're going to be basically being the first to take next gen in April of 2023. This fall, make a commitment in your program to do case-based curriculum. Make it a part of your act. And the truth be told, it's not really part of the curriculum. It's just in essence, a active learning strategy. That's much easier because even Dr. Benner said you don't have to do a concept-based curriculum or any curriculum change to transform nursing education. Simply change the way you teach. Move away from the slides. Move away from being that sage on the stage. Make it active, real. Case studies can do that. And so I just want to encourage you, doing at least every other week. If you are doing case studies, my personal preference, let's shoot high. Let's have a high bar. I love to have a high bar with my students as well. High but realistic. I want to do the same with you. How about let's pretend we're from Texas. Let's go big or go home. Every week, let's do case-based learning of some kind. Doesn't have to be the same type of case study, but let's bring an application that is patient-based scenarios into our programs. And so I'd love to give you that kind of that encouragement and what that looks like. And Karen, you got a question. How do you get faculty to buy in, moving away from PowerPoint? Boy, that's a wonderful question, Karen. I'm going to share with you just kind of I'm going to be really blunt with you. Your faculty need to read this book. This is 10 years old now. Dr. Benner, I don't think it gets any better than Benner in my book. I know that's the same for you as well. But you know what? She was the lead investigator of this study of the Carnegie Foundation that still is relevant to us as nurses and educators. Educating nurses, a call for radical transformation. And Karen, what Dr. Benner advocated is basically educational best practices in this book, had 3 paradigm shifts that Dr. Benner and her colleagues advocated for. Number 1, we need to integrate classroom and clinical learning. Number 2, we need to bring context to our content. And third, we need to emphasize clinical reasoning. And when I read that 11 years ago, I recognized that case studies, and even there's a case study exemplar from Lisa Day, who's a prominent educator, used to be at Duke, is now elsewhere. But Lisa Day is one of Dr. Benner's colleagues, and she had an exemplar in the same book on using unfolding case studies successfully to accomplish these paradigm shifts. And so I say all that, Karen, to say this. Educational best practice should not be optional for nurse educators. Clinical best practice, is that optional? Do we kind of say, oh, you know what? I've been scrubbing the hub with alcohol for the last 20 years and this chlorhexidine, I'm going to do it my way. Thank you very much. That's kind of what I call clinical nurse autonomy. Well, no, that's unsafe, and you're going to harm patients and increase the risk of line infections. It's unacceptable. As educators, it is unacceptable to not integrate educational best practice into your practice as an educator. If you are, you're really kind of belying the professionalism that you represent, not only as an educator, but as a professional nurse. And we need to embrace and then implement educational best practices. It's not about kind of my autonomy as an educator or whatever that word is. Like, it's kind of not coming to me right now as it relates to just the ability to do it my way in the classroom. It's like, no, best practice is kind of like rock, paper, scissors. So, in answer to that question, hope I didn't offend anyone, but I would simply say that we need to be we need to recognize that educational best practice needs to dictate our practice. And that's really my encouragement. And all that I do with Keith RN, if you want to keep it really simple, I just make educational best practice practical and easy to implement with the tools, case studies, and other resources. So educators who don't have a lot of time can simply jump and run. And that's kind of where my passion, and so blessed to be able to continue on this journey. So thank you again. That was a wonderful question, Karen. Thank you so much for asking. And Shannon, I do agree. This is a must read, by the way. If you're at your phone or laptop, go open up a window after I'm done, or do it right now. Get this book, and more importantly, read it. The first 50 pages is really all you need to read. There's a lot of good content. It gets a little heavy at times, but then share it. Share it with your faculty. Talk about this book in your department meetings, what you took away. Get some passion, reignite, and be an agent of change, because you know what? We still need to transform nursing education. We haven't accomplished it yet. We're moving in the right direction, but excited to do so. So anyways, Melissa has a question. Is there anything you recommend when you hear crickets during a case study? Some cohorts seem very quiet and don't appear very engaged. And, it's like, Melissa, you can't, you can lead a horse to water, you can't make it drink. And, we are limited. Students have got to want to desire it, Melissa. And I would just kind of, motivation matters. And so, Melissa, if I was in your classroom and you're hearing crickets, don't make an assumption that, they're disengaged and they're just not interested. I would ask the question, that's kind of the elephant in the room, is there a reason that you're not engaged? Is there a reason that, that you don't seem to be that involved? And kind of just gently, call it out and address the elephant in just a respectful way, not to put them on the spot in a negative way, but to kind of see what's going on and encourage them, kind of just advocate for case studies, saying, what, a lot of students have this misnomer, I'm teaching myself. It's not true. You know what? You are just giving them the tools to use their brain to apply knowledge. And so therefore kind of sell case studies to your students. Say, what? Active learning, nursing is a practice-based profession. So I would say another strategy, Melissa, explain the why of case studies, the why of active learning, of any strategy, that it's not just kind of like that there's a reason for your madness, that nursing is a practice-based profession. And therefore, we need to integrate practice realities to practice the clinical reasoning. And so if we do that, Melissa, give them an understanding of the why, get to the heart of their motivation. Are they stressed? Students are stressed and burdened, and sometimes they're just like overwhelmed. Let them talk about that. And then support them and just kind of get to the heart of what's the real issue without making an assumption. So, Melissa, that's just my thought. But Shannon says, yeah, be patient. They will finally come up with answers. Some students are quiet because they're thinking. Some are verbal processors, but some students are different. They are quiet and they like to think, and they're introverted. So give students the grace to kind of be unique in what that looks like. So yeah, it is hard though. It's kind of like when you ask a student a question in clinical and they don't have an immediate answer. What's your first response? Give them the answer. It's harder to be quiet and just kind of pause. And then finally they come up with that answer. Or you can ask a reflection question, a Socratic question. What is your thinking? What is, why did you see it that way? So think about additional questions, Melissa. Use Socratic questioning, which is really just asking the what and the why, to probe the question even deeper, to see if they can kind of go there. So that would just be my thoughts and just some other thoughts. And, Laura says, this is a great question. I have a small class and I hear crickets often. So Laura, I hope you found, I'm just throwing my suggestions. If you as educators have found some things helpful, this is a community and this is your time. And so I want you, if you've got some strategies that you found helpful in your classroom to manage crickets, throw it in the chat. I'll call it out and would love to see that. And so anyways, Kendra asked the questions, are your case studies only at the RN level? I teach an LPN program. And Kendra, the cases I've written, my lens of practice is an RN at the bedside. I've taught at RN programs, but yet my cases have been used in practical programs across the country. And the feedback that I get is that, yes, sometimes there's IV medications, for example, that aren't used. That's beyond the scope of LPNs in some states. but the essence of the clinical reasoning, the higher level thinking that programs want their LPNs to be thinkers, not just technical nurses who are kinesthetic tasks. We want our practical nurses to be thinking. My cases do that, and they've really been successful to do so. So great question. I'd encourage you to definitely take a look. I've got a free COVID-19 case study on my website, keithrn.com. I'd love to get all of you, if you haven't seen it, to just get a sense of how I write my cases, which I'll talk about in just a little bit here. Vu has a question regarding cases. When students are split into small groups, do you each group answer the same questions, or do you assign questions for each group of students? And what I would do, Vu, is because a case study, especially the ones that I've written that I'm most familiar with, they're sequential. They start with a scenario, and then it goes to, what's relevant and why. Then it's the vital signs, the assessment, what's relevant and why, diagnostic labs, and then you get into the interpretation of what does it all mean. They're all really important. And so I would encourage you to do it this way as a general rule. If your case studies that you're using are sequential and they're all important, let's say you've got 5 questions, you got 5 groups. They all work through the 5 questions in that 5, 10, 15 minutes, or they come to class prepared, even better, and then have simply each group, then you just say, okay, group 1, what did you come up with question 1? They work through all 5 of them. Group 2, what did you come up with? And so kind of just, that's the way that I would do it. If you only do 1 question for each group, that would also work. It depends on how much time you have. If you've got like 10 minutes, then maybe assign it to just give them 5 minutes to basically then do 1 question, and then they can all put it together as a group. If you have a little bit more time, do it the other way, have them all do that. So Vu, great question. And again, just depends on how large your group is, but that would just be one feedback that I have and go from there. And so anyways, Think Like a Nurse just bought it for good, used on Amazon for $7. Well, Pauline, that's my student textbook that's actually being revised into the 3rd edition. Don't want to go into that right now, but that's a great price and awesome. Glad you found that. And so, yeah, I'm just looking here. Pauline says, Think Like a Nurse, I usually count 10 to 15 seconds in my mind, and then someone will usually respond to my question. So, yeah, give them 10 seconds, Pauline. Great point. So anyways, I caught up on questions, and Melissa just threw something in here. I'll just kind of look at that real quickly. Melissa says, why are students quiet? They don't want to look stupid in front of their peers. That's a good reason, and that's not an uncommon reason. And so I love what you're saying, Melissa, where you're saying, they're afraid of the wrong answer, but you make sure they know this is a place to make mistakes and to work through the thinking process. But then we come back and there's still crickets. You know what? It's all good, Melissa. You know what I love about your philosophy? You're recognizing that case studies, as well as your classroom, is a safe place to make mistakes. It's just like simulation. Why is simulation really valuable to develop clinical reasoning and judgment skills? Because nobody dies. Failure to rescue, failure to recognize, you know what? It doesn't happen in the real world. I mean, it doesn't happen in the skills lab. They still die, but live and learn, reflect, debrief, go deep, and then you're really going to strengthen that thinking. So excellent point. And so, yes, keep that philosophy going and take it from there. I've been answering so many questions. Haven't had a chance. I'm going to kind of highlight a few things here before we call it a night, because what I wanted to really talk about and just kind of highlight that not all case studies are created equal. Now, as a new educator, what I want you to know is that just because you hear the word case studies, there's a case study in the textbook. There's a case study in this workbook that I purchased that is, from one of the publishers in nursing. It doesn't mean it's as strong as it could be. And so what I want to empower you to do is use this lens to look at your case studies, because we want to be using the best tools and the best resources. So one of the things I want you to do is look at your case studies. So number one of my objectives for tonight's Facebook Live is that I want us as faculty and as educators to understand the why of case studies. Know that it is one of the most effective strategies to teach a practice-based profession. Then number two, let's use the best, or let's understand best practices. And one of the principles we want to reflect on with your cases is this. Do my case studies emphasize application of knowledge? Or are they focusing on the higher level clinical reasoning skills? Again, we want to focus on the thinking skills, not just simply knowledge based. It's kind of like a low level question. It's like a remembering comprehension. Let's go a little higher up Bloom's taxonomy to that application analysis level and really make sure our case studies are not just content application questions, but they're thinking, reasoning questions. Number two, multiple choice. This was one of my pet peeves as a brand new educator. The case studies that came in with the textbook were multiple choice. Now, this is what you want to look at your case studies differently. You want them to simulate practice realities, but do they do that with multiple choice? Absolutely not. They must be open-ended. And what I mean by that is this. One of the questions that I use in my case studies is this. Have the opening scenario. Then the first question is, what clinical data do you notice that is relevant? There's no multiple choice. There's no lists of answers. They have to look at that short paragraph, just like they do in practice. They look at the medical record. What are you noticing based on your knowledge that you're bringing to this scenario is relevant? That's it. You know what? That's practice. You either know it or you don't. Even the NCLEX. That's one of the weaknesses of the NCLEX. Majority are multiple choice questions. That's why they're going to next gen questions. They're going to be better, but still multiple guessing. Now, our students aren't guessing through the NCLEX. I'm not saying that. But what I am saying is as our cases need to replicate and be as realistic to practice as possible. Other case studies don't have a consistent framework. And what I mean by that is this. Tanner's framework, nursing process, is a consistent, iterative, repetitive framework that you can use to reason through any scenario. Look at your case studies. Look at the questions. They basically, if you look really closely, many of them from the publishers are basically each case study has a different set of questions. And they're not all emphasizing knowledge, or they're not emphasizing the thinking or the reasoning. The other thing to keep in mind is that they're single level and one size fits all. And so in essence, it's just kind of like, the curriculum. Why is it structured simple to complex? Because students are simple when they come in, and then we move to complex thinking. And, our case studies need to do the same. That's kind of why I inherently recognized the need several years ago to have different levels of case studies. And so I have a skinny reasoning case study that's short and concise, and then a more complex called unfolding reasoning that's over twice as long for advanced students with a change of status that needs to be recognized. And again, 8 to 10 pages in length, but very kind of get your students practice ready with the unfolding reasoning. So again, that's our goal, and that's what we want to be moving towards. And so as we look at just, some of the things that I just, when you look at I've kind of highlighted some of the things that I've been doing with my case studies in this conversation. And I just want you to recognize that it's been my goal with doing case studies the best that I can do, kind of like Chick-fil-A, and doing cases well, is integrating these best practices from the literature using my lens of practice. And that's in essence kind of, if you want to call it my secret sauce, using Tanner's framework, my unique lens of practice, and then kind of the framework that I've written. I've got a consistent framework of clinical reasoning that is integrated into every skinny reasoning, that's the concise version, or the unfolding version that is basically over twice as long. The structure, the questions, the framework, they're all the same, whether it's a peds, OB, mental health, and there's nobody in nursing education who writes them like that. And so I just want you to know there's some distinctives, not to brag myself or push myself up. I just want you to know that I'm doing it differently. And based on the feedback that I've gotten, if there's anybody here who's got any positive feedback of the resources I've developed, I'd love to hear it. But in closing, I want you to know that cases are a foundational strategy. So you know what? Bring practice into your classroom. Bring it into the clinical. Practice the skill of clinical reasoning. That's one of the big whys of case studies. If I could say that's probably the most important why. Do students need to practice sterile technique? Absolutely. Case studies provide the practice of clinical reasoning skills. And the one thing I didn't mention that's really important is that when I wrote my cases back in 2012 and now into the present, I recognized the value of Tanner's clinical judgment model in 2012. I've been integrating Tanner's framework in those steps of noticing, interpreting, responding, reflecting from the beginning. So the Keith RN cases are unique that they emphasize the same clinical reasoning process that captures the essence of next gen, as well as preparing them for practice, because the cases are going to ask the same questions they're going to use in practice. What are you noticing that's relevant? Why is it significant? That's the noticing. That's the interpretation. My cases have been doing that. And no other case studies for nurse educators really have that kind of distinct framework. And so I just want to highlight kind of what makes my cases unique. And so I just want you to know that I've got a couple resources for you. Number one is that download my dissertation. If you could do that, that would be, if you're an academic nerd and got a little bit of time over the summer, I wouldn't call it beach reading, but it's something that I would just encourage you to kind of just know that I'm not blowing smoke with the things that I've shared with you today. It really is what's current in the educational and the nursing literature. And I also want you to know that I've got a faculty guide. I am really proud of this guide. It was developed with a fellow in the Academy of Nursing by the name of Carolyn Humphrey. She was a journal editor for a home care magazine. That's where she got her recognition for a fellow. She was an innovator in home care in nursing education. She collaborated with me to help me take my dissertation knowledge, translate it into a faculty guide to help educators use clinical reasoning, understand it, teach it. Why case studies? And there's a lot of resources here. One of my favorites that Carolyn really kind of helped me do, that I took a lot of work, define your terms. I've got about 4 pages of terms related to clinical judgment, clinical reasoning, and related to case studies, and defining the terms to help students and help educators, more importantly, understand. And so I want you to know that this is a resource that's I've got a free download of a portion of it on Keith RN. And I also have case studies on Keith RN. You can purchase a select, very small number of skinny reasoning and unfolding cases currently, but the best value, I've got an all-inclusive membership for nurse educators, over 110 topics of unfolding case studies across the curriculum, maternal, peds, OB, mental health, written by expert faculty, because I'm not an expert in OB, I'm an ICU ER nurse, but I've got some great collaborators that have written some salient topics, and I just am so thankful for them. And so the membership is my best value. It has I've just revised the membership, and I just want you to know that I've got a new structure and some new features, including a next gen section that highlights the most effective tools of Keith RN to develop clinical judgment in the classroom, the clinical case studies, webinars that I've done with contact hours, and other new information. I've got some new handouts as well. I'm so excited to share on the membership. It's kind of my best value. And if you're a department, I can provide a no obligation quote if you just send me an email at keith@keithrn.com. If you want to put that in the chat, Amy, and I'm available for any questions you have. But it's really my passion to get the tools to transform nursing education. And that's kind of what keeps me going, even though I'm getting tired in my old age. But, I just want to say thank you for had some great questions. And I know it went a little over today, but I just want to say, I've got some, just going to look at the chat here. And I just want to say, just look here and say, Joyce says I teach fundamentals. And the first few lectures are on professionalism and clinical judgment. Besides the incivility case, do you have any other cases that reflect professionalism or have plans to develop any? And, Joyce, in the membership, I have over 20 what I call clinical dilemma case studies that I use to situate professional behavior and what that looks like with ethical dilemmas, medical futility, patient wishes not being honored in the end of life and transitioning to end of life. And some of those kind of messy things that nurses get involved with. I've written case studies, and the clinical dilemmas are inside the membership with a student version, a faculty version, and also integrate the same clinical reasoning framework of Tanner. What are you noticing in this dilemma that's relevant, and why is it significant? So yeah, that's a great question, and thank you for sharing. And Karen's found the COVID cases helpful and enjoyed how it was set up. And yeah, Karen, my goal with the cases was to really just bring in how do I experience practice? How does it unfold for me at the bedside? And that was my goal with Keith RN cases, was to take them from an opening scenario and then drip it. Starts then with the first set of vital signs, what's relevant and why, assessment, lab values, reasoning, Tanner. That's kind of my distinct kind of mark and what makes them unique. So yeah, I'm glad you found that helpful. And Rose loves the case studies. They're the best. Well, thanks, Rose. That's really awesome to hear. And Melissa likes them. With students get into discussions about how to recognize what is most important. And that's a great point. Students will see things differently. That's why small group work is so powerful with these case studies, or any case study, is to basically get them thinking, get them engaged, get them participating, and get their ideas. And you know what? Sometimes they're wrong. They make errors in clinical reasoning. That's why, like the other educator said, it's a safe place to make mistakes. If we missed something or we saw it differently, learn from it, reflect, and move on. And your students are going to have some powerful learning in your classrooms. And that's really what I want to encourage you to do. And Karen wants to read the dissertation. Well, Karen, let me know what you think. And if you have any questions, my email, I'll kind of pop it on the right here in closing here. So if any of you have any questions, feedback, feel free to reach out. And let me just kind of look at Sandra Love Tools. Thank you, Sandra. I really appreciate that. And Melissa says, I love the alcohol case study for my psych students. Yes. You know what? The ETOH withdrawal, that's a sneaky one. They evolve slowly with confusion, and you don't know why. Confusion and restlessness. Of all things on a med-surg floor, why would that happen? Well, we've seen it more than once if you're a nurse at the bedside. So anyways, Pauline has a question. Do you have any unfolding case studies for the new nursing student in a health assessment class? Pauline, in the membership, under fundamentals, I recognize that need. Dr. Benner says we have to contextualize the content. I brought context to fundamental skills. I have got a series of fundamental case studies that contextualize the skills of nursing that are most commonly taught, like bladder ultrasound, like the need for urinary retention. Like if we're going to teach like sterile technique with a catheter, then we basically need to think, how do we recognize that we have to even use that technique? That's the clinical judgment skills of could be a urinary retention with a abdominal pain. I also took the several main body systems and made case study exemplars. Like the respiratory assessment integrates the aspects of a respiratory assessment that you just taught in the context of an asthmatic patient. But I highlight and address the fundamental skills of respiratory assessment, give them a chance to break out and demonstrate the respiratory assessment skills on the student next to them, or whatever that context would look like. And so I've got cases that align with all of the main body systems that integrate the skills. And so, yeah, thanks for asking, Pauline. That was awesome. So other than that, if any of you have questions, comments, put it in the chat. I'll review it afterwards. Otherwise, join me in 2 weeks where we're going to be talking about using innovative active learning to transform your classroom. And this is where faculty struggle. So how can we put this all together? Lecture, case study, flipping or not to flip, scrambled or not to scramble. There's a lot of acronyms out there. And so we're going to talk about that in 2 weeks. I look forward to connecting with you then. And I want to thank you for joining me and have a great night. Blessings to you all. Thank you.